Good evening, I'm Tanvi Kadiri. I'm currently a senior at Westwood High School, and today I'm going to be talking about my research article, Overcoming Tumor Resistance, Targeting Stromal Components in Cancer Treatment. In this research paper, I aim to investigate the relationship between the tumor stroma and cancer. So, what exactly is cancer? Cancer is defined as the uncontrollable growth and spread of abnormal cells throughout the body. Its causes may vary, but early detection and treatment are crucial to managing the disease. A key component to the cancer spread is the tumor stroma, referring to the supportive tissue surrounding a tumor. This microenvironment plays a critical role in tumor growth by providing structural support, nutrients, and signals that can influence the behavior of cancer cells. This environment's role will be further investigated in this research paper. Some common cancer therapies include chemotherapy, radiation therapy, immunotherapy, hypothermia, and surgery. However, each has its pros and cons. For example, chemotherapy uses drugs to kill cancer cells, but also affects healthy ones, causing side effects like nausea and hair loss. Furthermore, traditional cancer therapies like chemotherapy often face challenges in fully getting rid of cancer due to the tumor stroma's interference. Chemotherapy targets rapidly dividing cells, but isn't always successful because the stroma can adapt. Instead of causing cell death or apoptosis, the treatment may allow stromal cells to survive and continue supporting tumor growth, leading to overall less effective results. I then came across a possible solution, nanomedicine. Nanomedicine offers a solution by using nanoparticles to improve drug delivery and target cancer cells more effectively. Some treatments have actually already been approved, I believe. However, further research is needed to enhance these methods. In addition, studies have showed that CD40 targeting therapies may reduce tumor growth by reprogramming the tumor microenvironment. The tumor microenvironment plays a big role in the growth and treatment of tumor cells. So in a tumor's early phases, a relationship forms between the tumor cells and the surrounding microenvironment, which overall supports cancer cell survival and spread. For example, as tumors grow, they often face a lack of oxygen and a surplus of acidity. In response, the tumor microenvironment promotes the formation of blood cells, which delivers oxygen and nutrients to the tumor. What's going on? So my research was conducted by reviewing various credible scientific journals from PubMed and studies from clinicaltrials.gov. Previous articles about standard cancer therapies and how the stroma affects resistance were analyzed as well. In addition, multiple studies were analyzed for the use of stroma targeting strategies with traditional cancer therapies. So I have concluded that the use of nanomedicine to regulate the stroma sounds promising. However, more research is needed. In addition, using molecules or antibodies targeting specific signaling pathways in combination with traditional cancer therapies can lead to increased effectiveness. In conclusion, again, in this research paper, I investigated the relationship between this tumor stroma and cancer. I found significant promise in the use of nanotechnology and targeting specific signaling pathways to increase the effectiveness of these therapies. However, for future research, I plan on taking account of more literature, especially those involving, for example, monocytes. Although several studies have been conducted on monocytes, I've only been able to review 5 of these research papers. In addition, like patient privacy rules may have impacted the applicability of my findings in the real world. Finally, I would like to recognize Dr. Prahalad, Professor Virgil, and Coach Joe who have been so helpful in the process of me writing this research paper. Coach Joe, I'm so thankful to have the opportunity to participate in this program, and I hope to carry on the lessons I've learned and the skills I've developed. Thank you so much.
Awesome. Awesome. Thank you for the kind words. And we want you to continue and become like major researchers and physicians in your field. It's like quite unbelievable that what we're witnessing today is being presented by high school students, right? So a big round of applause to each and every one of you who survived this program. It's not easy, but you're here, you're presenting, and it's a wonderful feeling. So let's go with, oh, sorry, your question, Dr. Prahlad.
Yeah, so one quick question. So nanotechnology, so are they carrying some drugs or do you have any specific information? How are they being used?
Yes. So this nanotechnology is not exactly, it like carries certain drugs, such as that like targeted like pathway drug to better access these cancer cells. So it's basically just improving effectiveness. It's not necessarily the like treatment itself.
Okay. Excellent. Great job. Congratulations.